Griffin Hospital is a 160-bed community-based hospital serving the lower Naugatuck Valley. We are a Planetree hospital, which is focused on patient experience and putting the patient in the center of their care. So moving to an electronic program really helped us to improve those scores dramatically. What made BioVigil stand out for us was the visual hand icon on the badge, which really opened up for dialogue between peer-to-peer, as well as between our caregiver team and the patient and the family, and it created awareness on our hand hygiene practices.
So BioVigil is an electronic hand hygiene system, or I'll call it an electronic hand hygiene solution. It's not just collecting hand hygiene data, it's also coaching staff to improve hand hygiene performance. It's more like your personal hand hygiene coach. Because with BioVigil, we have these great visual cues. And now it's easier to approach someone and say, hey, you have a red hand on your badge. Do you want to go back and perform hand hygiene? And the visual cues, they also create patient engagement. They're eager to ask, what's that red hand on your badge? What's that green hand on your badge? What does that mean? And that's why we've seen our hand hygiene compliance improve from about 60% to 90% at the moment. So it does more than just collecting data. It helps change culture, it helps change practice, and it helps keep your patients safe.
BioVigil has helped with meeting all of our requirements for CMS and Leapfrog, especially Leapfrog, because Leapfrog has a requirement of a minimum of 200 hand hygiene opportunities per unit per month. So if we didn't have an electronic system like this, we'd have to have people actually monitoring. All of the reports that we get from BioVigil, we report to our Safety Council, to our Infection Control Committee, to our Clinical Performance Improvement Committee, and Regulatory Committee. So that captures a wide range of individuals and disciplines throughout the hospital, and they get to see what the hand hygiene compliance is. The Department of Public Health may request audits or an audit tool from the compliance reports, and we would be able to easily provide that to them, something that we didn't really have before.
We're all a little competitive, so with the reports and we get our reminders of our hand hygiene every week, it kind of can be fun to tweak it, to turn it that way, almost as more of a competition. Oh, you were 91%, I was 96. I can see how often our caregivers are in and out of the rooms. So as far as things like hourly rounding with our patients or how often we're checking on our patients, it's validation for the team members. It's also really helpful because it's a quick turnaround. Some of our metrics, some of our scores, some of our quality improvement measures that we're working towards on the units, it takes longer to see the reward of your work. With this, an employee, if they're underperforming, they can see the turnaround within 1 week. I think it's definitely been helpful in that aspect.
If another organization was considering to use BioVigil as their hand hygiene solution, what I would encourage you to think about is, how do you know what's happening every day in every room of your hospital? We learned that we couldn't watch every day. We did not know all of the time. So by using this program, we know that it made an impact. Having transparency in hand hygiene has really helped us to say very proactively to patients, we value your safety, we value you, and we want to show you visually that every person walking into your room come in with clean hands as they deliver care to you and your loved ones.